Welcome back, everybody. Joining us now, we have Iowa Veterinary Specialties, DJ Newhouse and Kristen Reams. Thank you so much for joining us here this morning.
And special guest, don't forget about.
That's right, special guest Izzy.
Izzy is here as well, hanging out in the middle and just making it. There you go.
Can't
Shake it
forget
out.
Izzy.
Say I'm here too. You guys are part of a very special department with Iowa Veterinary Specialties, and that's oncology.
Yep.
First of all, let's remind everybody at home, what does that mean, oncology, and how does that look like with the Iowa Veterinary Specialties?
So we do chemotherapy. We have electrochemotherapy. We do palliative care for if people don't want to do chemotherapy and treat. We kind of do some hospice in oncology with Dr. Green. So just whatever anybody decides to do. They come in for a consult with her, and then whatever type of cancer they have, they provide the options of different types of treatment. For lymphoma, there's multiple protocols that they can do. So there's just different types of chemotherapy for each type of cancer.
Talk about how that, with pets, and how, is there a difference in how it's applied with our pets versus us as
Yeah,
humans?
there is. Yep. So for our pets, we strive for patient care and to make the patient as comfortable as possible. On the human side of things, they strive for longevity, and unfortunately, I wish all our pets would live forever. But our goal is to make them as comfortable as possible through this whole process. Not only the pets, but the owners also.
Are there any statistics? Because a lot of times when you say cancer, you don't think about an animal or our loved ones being dogs or even cats getting cancer. How
So
commonplace is
every
that?
type of cancer has different statistics. So it just depends on the type of cancer.
But is that something that's kind of common? I don't think it's common when I think of animals, but obviously you guys exist because it's out there.
It's very common.
Is it?
Yeah,
Yep.
unfortunately. Yep.
Are there more than others? I know you say there's different kinds and different statistics, but if an animal's brought in, what kind of symptoms are we talking about that we might need to bring a concern so that they come and visit you and say, we need to look at this?
Right, yeah, it's very vague. Unfortunately, a lot of times we hear all of a sudden they just felt these masses under their chin or they stopped eating, and then they come to us, and then that's when they get diagnosed with their cancer.
Okay.
Yep. Vomiting, not eating, just being very lethargic are all very common symptoms, but it's different for each pet.
Yeah, everyone's a little bit different.
Do you find more people coming in with insurance plans and programs for their pets to kind of help offset some of the costs that are associated with these types of treatments?
Yeah, so there are just so many insurance companies out there for pets. So I tell everyone, obviously it's kind of like human insurance. They don't cover pre-existing conditions. So if it's been diagnosed, it won't be covered. But I tell people to really do their due diligence with the insurance. Some of them cover preventative care. Some of them cover, it's like human health care, honestly. They have to pay up front, and then the insurance company reimburses them. But we do have Trupanion Express. So if they are pre-approved through that insurance program, we can file the claim for them, and they only pay their percentage. So that's one of the insurance companies that we're able to work with to maybe offset the upfront costs for the owner, because they're going to get reimbursed. So
absolutely. Let's talk about difficulties this time of year, especially when you're thinking oncology. You mentioned making sure the animals and the family members are lifted up, but also I imagine staff members as well when you're dealing with situations like this.
Yeah. I mean, obviously, it's a terrible diagnosis, any type of cancer, but we do try to do things for our staff, and there's a lot of burnout in the field, in general, in the veterinary field. A lot of emotions. So just trying to do fun things and kind of come together as a family at work and taking care of other people too. So.
Absolutely. And we want to talk about a couple of those opportunities this morning. One being Tinsel for Tails. What's this all about?
Yeah, so I can't remember how many years we've been doing this. I want to say like 4 or 5, maybe more than that.
Yeah, more than that.
Has it been more than that? Yeah. So what we do is we do a donation drive. We try to start the beginning of December, and it runs through January 31st every year.
Okay.
We're a referring veterinary clinic, so veterinarians refer to us, your daytime clinics where you go for vaccines, spaying and neutering, dentals, that type of thing. So we have they refer to us, so we reach out to all of the local clinics in the Des Moines area, and we ask them if there'll be a drop-off site. So what we do is we get donations for local animal shelters and rescues locally in the area, and then we have the participating clinics have boxes there too, so that they can drop off. Their clients can drop off too, and then we go and pick up every once in a while until the end of January, and then we bring it back to the clinic and we divide it up and we split it between a few clinics. So.
Oh, I love that you're giving back to others that are referring to you guys. What's the biggest need that you hear? I'm sure a little bit of everything, but what's the biggest thing if people could make a donation in the next month or so? What would you be asking for?
Anything, food. I mean, honestly.
It all,
yeah.
You know, I think flea and tick medication.
Ooh, okay.
Because that's not a prescription, and it's very expensive for the rescues unless they have a contractor or they have someone who donates a lot. Food is important, and I know a couple of the rescues that I work with they feed high quality food. So high quality food would be good. Collars, leashes, beds. Anything to make the animal feel more comfortable at the rescue or the shelter. So,
and a lot of those shelters and rescues, it's a labor of love, and they're going above and beyond to help all of the different animals, so they do truly appreciate any assistance and help that they can.
And we're grateful for the referring veterinary clinics, the daytime clinics in the area, because we really get a lot of donations from them.
I love hearing that. Okay, so please consider donating and giving this time of year. Various drop-off locations, with our station being one of those. If you just want to drop something off, we will make sure it gets to the right people. Let's talk about adopting a family. What's that all about?
So Adopt a Family is something that we've been doing for the last 4 years. It's through West Des Moines Human Services, and you sign up and they give you a family to sponsor for Christmas. And it's really, really nice. We did it this year, and the family had 3 boys, and it was amazing to see their face when we brought the presents to them. So we got all of our staff to donate, and then we went shopping, and we had the best time buying these little boys presents and clothes and then dropping them off.
I love that.
Yeah, it was really fun.
You guys are giving back in so many ways of making sure we all feel the Christmas spirit, holiday spirit, even beyond the Christmas season. And tell us a little bit about Izzy here, who is hanging out.
Izzy's 12 years old. She's been an amazing dog. She used to be an agility and a therapy dog, but now that she's a little bit older, we stopped the agility. She wasn't really successful at it either because she loves people, so she would leave the ring and go say hi to the judges.
Yes.
We never won one time. But she just
like
loves
my dog and daughter, and
she just
dog
loves
obedience.
people, and she loves to do things, and she's a good girl.
Yeah, it's amazing the comfort and love that comes
Oh,
from our
absolutely.
animals. So we want to make sure you know about incredible services that are available, so you're continuing to take care of those animals and loved ones in your life. If people want to reach out, if they want to know more information, what's the best way to do so?
Yep, so they can either call us, 515-280-3100.
Okay.
They can shoot an email. We have email. They can reach out to their regular veterinarian, and they can call our clinic and speak with one of our doctors regarding the case, or they can call and make their own appointment if they want to.
They can't, so they don't have to be referred by another
We prefer
veterinarian.
that they're referred, just so
Okay.
that their veterinarian is in the loop on what's going on, and we want to get records from them too, so that we're not repeating tests that their regular vet has already done.
Makes sense.
But if they can't get a hold of them, or they're scared and they want to come in and talk to Dr. Green, which a lot of the phone calls are, they're very scared. They don't know what's going on. Their animal's not doing well. They can call and make an appointment. We do have ER services available too, and our ER is open 24/7, 365 days a year. So if they're having symptoms and it's a Friday night and an oncology is not in, they can come in through our ER, and then the doctors will do a workup there. And if they need to call Dr. Green in, she's on call, and DJ's on call. He comes in and helps out too, and so we all kind of work together in our departments. We have acupuncture. Anything you need to do, we have it.
You guys are
Well,
incredible.
keep up the great work over there.
Thank you.
Yeah, thank you for
Thank
everything
you.
you're doing. And
Thanks
don't forget
so much.
about Tinsel for
Yes,
Tails.
please donate.
You make a donation to give back to all the
Makes a
amazing,
difference.
wonderful
Yes.
organizations that help support our four-legged friends and beyond.
Yeah.
Thank you again for joining us.
Thank you so
Thank
much.
you.
Thanks, Izzy. All right.
Good job, Izzy.
TV star in action. You're